If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411. This is Mabel Scott. I'm your Public Information Officer. It's time for an update from Susan Young, the Rockingham County Interim Public Health Director. Good morning, Susan. Thank you for being here. October 2nd, 2020. This morning we were all very, very surprised, and we are, I guess, thinking of the song Pray for the USA as we heard the news about the positive test that President Trump and First Lady received. Please give your insight.
Well, it's not surprising with the community spread and the spread of the COVID. I mean, not just in our country, in countries all across the world, that, it would eventually touch someone who was in a powerful position. And, with that role, the president travels. He is around a lot of different people. He is in close proximity with a lot of people. Social distance is almost impossible in his job at certain times. He has been on, airplanes, helicopters, with his Joint Chiefs of Staff. And no matter how careful you can be or what precautions you can take, people can be asymptomatic and not showing symptoms at the time, but then you can catch it, because that person does not know they're sick yet, but they can be spreading it to others in that pre-phase before they actually have symptoms or actually know they're positive. Even if you're testing people twice a week, there is a window there that, there's 2 days that person can be infectious.
I understand. Another big news story was North Carolina Governor Roy Cooper, and he gave us some more space to move around in.
He did release some. Phase 3 does release some of the restrictions that were in Phase 2. I think one that hit a lot of people was the large outdoor venues with the seating of 10,000 or greater, where they can have fans in the stands for sports events, football games, and things like that. I think, people want to go see their college kids play ball. They want to go to their sports venues. So I think that will be hopefully safe, and it will also boost the morale of people getting to do some things that they want to do. The bars will open back up at some capacity, amusement parks, things that have not been open before, movie theaters, those will all have capacity limits, but it will be some different things that people who do feel safe and who do want to go out can have that entertainment and enjoyment. Now, the indoors, in an enclosed indoor space is still 25, and outdoor gatherings are still at 100. So that did not change. So everybody just needs to remember that. I mean, this goes for like receptions and things like that. If you're having those, that limitation is still in place, and people really, really need to follow that. And Rockingham County is seeing an increase in cases, so we just need to be aware.
And that leads to the next question. Tell us about Rockingham County.
So currently we have 1,340 cases. That was of this morning. That is going to rise. We had 30 plus cases yesterday, and those are not long-term care facility cases. That is community spread cases. Some we do not know where they got the virus, but people are out and about more than they were. And you got to remember to wear that mask, social distancing, and I will parrot Roy Cooper. It's personal responsibility at this point. Everyone has to make their own decision. Am I going to follow these rules and do what I know that I need to do by wearing a mask, social distancing, and staying at home? Or is it more important for me to go out and do social things? So everyone has to make their own personal choice of what they want to do at this point to protect themselves and everyone else. And I strongly, strongly advise wearing the mask, social distancing, washing your hands, and just being safe for everyone.
So continue to do the 3 W's.
Yes.
Okay. What about Rockingham County Schools?
Well, the schools have opened in-person learning back on the what they call the AABB schedule. So you do have students, some students, if they choose to, attending classes on Monday and Tuesday or Thursday or Friday. So that puts the kids back together in a learning environment that is good for the children. It does also pose some risk, and it's a calculated risk. And we did have kind of a little hiccup the first week the kids were back in school. We did have a cluster at a school that had to be taken care of, and that was handled very efficiently, very quickly. The school staff did an excellent job. I cannot give them kudos enough, and the protections they put into place for their staff and their children. And we all worked together, and they made some decisions and went from there, and we hope everyone will be protected and safe.
You kind of alluded a few seconds ago about the long-term care facilities. What about them right now?
Well, the long-term care facilities are improving. We're seeing a lot fewer cases in the long-term care facilities, and that has greatly improved some of our numbers in that realm. So that is looking much, much better and improving.
October Think Pink Month for breast cancer awareness. Why is this important?
Well, the statistics say it all, Mabel. 1 in 8 women in a lifetime will have to deal with a diagnosis of breast cancer. So if you think about that and you have a room of women, just 1 in 8 of those are going to have to deal with that in some sort of fashion or form in their lifetime. So it's very important. But the wonderful thing about breast cancer is if you get your mammograms, you do pre-screenings, you do the things that you know to do to keep yourself healthy and safe, you can cut that risk of having any long-term problems from breast cancer. If you get treatment and seek treatment and get it taken care of, you can live a healthy and productive life after breast cancer.
It's all about going to the doctor, getting the
Yes.
exams.
And we do have some monies that just came down that we know we will be offering more services through our breast and cervical cancer program here. So if anyone is uninsured, please call us and we can see if we can get those services connected to you to get you the screenings and the mammogram or whatever that you need and have that paid for.
Called the Rockingham County Public Health Department.
Yes.
Good, good. Also, this month, as we look at fall, we think about flu. What do you want us to do?
Please, everyone, get your flu vaccine. This is a critical year because you do not want to be co-infected with COVID-19 and the flu. That will be a very scary situation to be in, and nobody wants to be there. And if you can prevent yourself from getting the flu, the COVID vaccine is not on the horizon quite yet. So what you can do is get your flu vaccine and get protected from the flu. We will start giving flu vaccine here at the Rockingham County Health Department on Tuesday, and it will be a drive-through clinic. So from 9 o'clock in the morning to 4 o'clock, you can drive through in your car, and we will get you taken care of and get your flu shot.
Now, what about the costs and everything?
If you have insurance, please bring your insurance information. If you're uninsured, there will be a $30 fee, but we will work with you on that.
Okay. Boo to the flu as you think about Halloween.
Absolutely.
Boo to the flu. And now, what homework do you give us today that you always give us every time?
Well, it's not going away, so the message is the same, Mabel. Wear your mask. Wear it appropriately. I see people all the time with their mask down below their nose, up above their mouth. Wear it appropriately, covering your nose and your mouth. Stay at least 6 feet apart from people who are not in your direct household. Even includes your extended family and family you do not live with. And decrease your socialization. If I know it's hard, and I know we all are very social creatures, and we all want to go out and do things and socialize and have some sort of a normal life. But it is so important to keep up the work that we have done. We have kept our case counts in this county very low. I am so proud of the hard work that this county has done, and the death rate. Unfortunately, we did have 2 deaths this week, so our death toll is at 23. That's very important, that we need to keep up the work that we have done and keep going and keep moving forward with our mask, hand washing, social distancing, and staying at home, especially for that high-risk populations.
And again, we want to say an extra prayer and thought and send out our love to those who have been affected and to those who are still in recovery?
Yes.
The recovery rates are,
I don't exactly have that number, I think, with me today, but they are a lot larger than any other
They
number that
are.
we have.
They
We have had
are.
lots of people that have recovered and made a full recovery and are continuing on.
we are so thankful for that.
Absolutely.
Yeah. So we're wearing the mask because we love you, and we're wearing the mask because we respect you, and we're wearing the mask because we want all of us to stay as healthy as possible. Let's all join Secretary Mandy Cohen when she says, "Stay strong, North Carolina. We can do it together. And let's think about our family and our friends." We'll see you next time. Rockingham County 411. You're in a good place.